seasons of turbulent times and rapid change, it's often easy to miss ripples of hope and reasons for optimism. I like to pause from the chaos confronting our world today to focus on a milestone moment and an African history maker. Dr. John Nkengasong, U.S. President Joe Biden's nominee, has now been confirmed by the United States Senate as the first African-born American to serve as Ambassador at Large and coordinator of PEPFAR. PEPFAR, the U.S. President's emergency plan for HIV/AIDS relief, is the largest global health initiative in U.S. history. With more than $100 billion already invested, PEPFAR is credited with saving over 20 million lives. In line with the threats of our day, the PEPFAR portfolio is now expected to include pandemic responses and global health security. With more than 3 decades of experience in virology and public health, Dr. Nkengasong has many path-breaking distinctions. As founding head of the Africa Centers for Disease Control and Prevention, he was tested, tried, and yet triumphed on the front lines of the wars against HIV, Ebola, and more recently, COVID. The former principal deputy director of the U.S. Center for Disease Control and Prevention, he has been knighted by many African heads of state and is the recipient of the Bill and Melinda Gates Global Goalkeeper Award. Time magazine named Dr. John Nkengasong as one of the 100 most influential people in the world in 2021. Perhaps Dr. John Nkengasong is best described by a Zimbabwean journalist who called him Africa's hero doctor who met COVID-19 and Ebola head-on. I was delighted to have spent time with Dr. Nkengasong and his wife Susan recently here in Accra, Ghana. Join me in what is arguably the first intimate profile of this 5-star general in the war against pandemics. What a remarkable and inspiring journey. Dr. Nkengasong, many scientists believe that the fundamental building blocks of who we are as people, it's already formed by the time we're 7 years old. I'd like to hear more about your journey from Fotabong, Cameroon, born in 1964, in a miraculous way. Had parents who lived beyond 100. I mean, your mom lived to 103. Just tell us about your journey. What were the building blocks from that time of birth in Fotabong, the time with your parents, that prepared you for this interesting and challenging time and this global role that you're playing?
Thank you, Rosa, for the question and for having me in your studio. I was born, I was delivered where my mother was way above 50. And nobody expected that at that age you would have a baby. And so she was literally forced out of the village because it was conceived in that setting as witchcraft. So in order to protect me, she went out of the village, stayed with her sister in another village, and I was delivered, and she came back to the village with when I was 3 years old. So that is my story. So my father and my mother didn't go to school. They didn't, she was, my father was a chief in the village, and my mother just was busy focusing on me because I was the only thing she had at that time. So fast forward, when I was 6 or 7, she moved from the remote area to the city because she wanted me to be closer to her sister's children, so that I could blend within the 6 children that her sister had. So that was my opportunity there to have siblings, to interact and grow up feeling like I had some other a family growing up. But she was very committed to my education and upbringing. And so remember, she's peeled off now from the village, lived my father in the village who was a chief and couldn't move because she was a chief in the village. And so she took upon herself to do very basic subsistence farming to make sure that she sent me to school. So that is how I got secondary education. After primary school, went to a mission school. Actually, I remember that when I left primary school, she had only $40 to pay tuition. But it wasn't enough to get me to the school that I had passed my common entrance to go to, which was the St. Joseph's College, Sase, which is a top Catholic school. So spent 1 year at home. She gathered a little bit more money and got something that got me to a mission school. So she was very committed to, and somehow, without going to school herself, knew the value of education. Or maybe I would say knew that it was important for me to go to school. So Cameroon at that time had a policy where you, after high school, you got a scholarship if you studied hard. And then the university was free, and if you study hard, you also gave you a stipend. So because of that system, I went to high school and got admission into the dormitory, and then went to university, got admission into the dormitory and a stipend, and the rest is history. And left and went to Europe. After that, had a scholarship and went to Europe and studied in the Institute of Tropical Medicine, where I studied virology. And then that became a whole different pathway, which I'm sure that we'll be able to talk about.
Wow, now we know where you got your courage.
Yes.
It was from Veronica and Nkengasong.
Yeah.
Wow.
Yeah. I think she was very determined, very religious, believed a lot in God because of what her life was. Because if you have to put that in context of, at that time, the mode was for many families to have so many children. And so she had children that she delivered and they died. And so then came me. And so
after she was 50 years old.
Yeah, after she was 50.
With
yes,
no help like modern medicine.
No, that was far.
Surrogates,
I don't think she knew where the hospital was. It was literally God's guidance and God's promise, I believe. That was, but she taught me character and determination to succeed, because I saw her working hard to support my tuition. And remember, it was not more than $40. That was what was required to go to school. So I saw her, the determination she had, the character she had, and the emotional intelligence that she displayed by reading people. And as the saying goes in the village I come from Fotabong, that an animal grows in the forest by hiding their footprints. So she would make sure that I was protected and cautioned, and also I learned character a lot from her.
Wow, that's incredible. You know, there are a lot of villages across Africa, and unfortunately, they look very much like the village you're describing that you came from around in the 60s. They haven't progressed very much. We still have too many villages without electrification. And there are a lot of young people, though. Most of them have cell phones. So they're probably looking at you now on their cell phones, because in addition to television, we are on YouTube. And I believe they're inspired. What would you have to tell them about making it? Because I meet a lot of them. Some of them have hope, but sometimes their dreams have been so deferred that they're without hope.
My advice to the young kids in the village and young people will be that education is the gateway to success. Education is what underpins that hope, and that would make that hope, will make you, as I usually say, it's not enough to dream. You have to wake up from that dream and live the dream. So the gateway to that is your education. Be committed to your education. Don't be distracted by trying to make money very, very early in the village, because it will give you the money and but you stay in that village. So the only way for you to progress and live your dream will be, in my experience, is to go to school. Try to get yourself educated as much as possible.
Education can be the great equalizer.
It is the great equalizer. It is that democratic process that allows for what I call social elevator, which can take you higher to the next floor and to the next floor and to the next floor.
You know, I have talked to a lot of people in the medical profession about you, doctors, and they all say that you're just gifted in medicine. They call it a gift. They say you're just extraordinary. And I was wondering, why biology? Do you think maybe it had something to do with your miraculous birth, with a mother giving birth beyond 50, or having parents, your mom living to 103, your father lived beyond 100? I mean, what influenced? But that was discovered later. You had no way of knowing at that time how long your parents were going to live. Yeah. But what influenced biology?
I think the real answer is, from my own beginning, humble beginning to where I am, is that very early on at that stage, you truly don't know where you are heading to. I mean, your pathway is a shot in the dark. And I'll tell you that when I graduated from the University of Yaoundé, my interest was to be a wildlife conservator. And just because I thought that it was something that was neglected, and you could serve humanity with that. And I remember meeting one professor, Professor Victor Anomangu is his name. And I'm really honored that Cameroon gave me the gold medal in honor of his, just recently, 2 years ago, where I went to his office and I said to him, Professor, I've just graduated from the university. I want to pursue a career in an MSc and a PhD. And he said, and I told him that I was interested in, first choice would be wildlife, and second would be entomology. Entomology is the study of how insects impact humans, like mosquitoes, how do they affect people. And he listened carefully, and he said he was in this jacket. He was a former minister, very renowned, and had received the Lasker Award, which was a very big award given to him. He looked at me and he said, I think virology is exciting. I didn't know what virology was.
Wow.
So I went back and to the library, because remember at that time there was no phone with Google to Google stuff. I quickly ran to the library, search, and then it was like, wow, this is a big area there. So that became a foundation on which to build and begin to shape my future. I say that because mentorship, no matter what your genetics, how your genetic architecture is designed to guide you into the future, the people that you meet and who become your natural mentor. And I say there are two types of mentor. There are virtual mentors, the people that you see every day in classroom or at work. And there are others that you only admire them from a distance and you want to be like them. So, I mean, I urge the young people to look for two mentors all the time in your life. I mean, the people that you see physically and the people that you admire distantly there.
And who are some of your mentors besides this professor?
I think that when I went so I left Cameroon. Mm-hmm. It's interesting. So because that professor said virology, I looked for at the medical school an internship to do hepatitis B. Hepatitis B is a virus that causes liver problems and is very prevalent in Africa. So I remember one afternoon at 1 o'clock, I'll never forget that. I was in the laboratory testing for pregnant women who had, and their children to see if they had levels of, they were infected with hepatitis B. And I turned my head and I saw Professor Peter Piot, who was a professor at the Institute of Tropical Medicine in Antwerp, had come to Cameroon to visit. And that was just the beginning of HIV in the 1987, 88. And I remember me waving him and to give me time to finish what I was doing. So I finished what I was doing, and then I went out and he asked where my boss was. My boss at that time was Professor Peter Ndumbe at the medical school, and he had traveled to Abidjan for a meeting. So he was surprised to see me at that age of 23 in the laboratory at midday, being very serious on working on experiments and without your boss, because the tendency was that when your boss was not around, you disappeared. So he arranged for me to get a scholarship to go to Belgium. I went to Belgium and continued to study virology. So from where the Professor Ngu and that discussion with Professor Ngu and going to Belgium, he became the link that made that dream to come true. So again, the whole power of mentorship and meeting the right people in your life. So because, as I said, my parents didn't have the money to even send me to Nigeria, not to talk of going to Belgium. So he's one of the mentors that I had, physical mentor that we continue to stay in touch.
Great.
I mean, and just.
I was going to ask you, has he seen your
meteoric
rise
and
impact?
He went on to become the executive director of UNAIDS, the founding executive director of UNAIDS, and then just recently retired as the director of the London School of Hygiene and Tropical Medicine in London. So he's always been that life model, inspirational model that I see. But virtual models are those people like Tony Fauci at the NIH. When I was in graduate school in Europe, everywhere he gave a talk, I would run to that talk and make sure that I sat in the front row with my little recorder. I mean, remember this is in the 80s, and there were these little recorders that you could turn on and you played, and you go back into your little thing and you listen to.
I remember.
So he just became a mentor that was not present, but how he presented science, how he analyzed science. He used to give, he delivered always a seminar lecture called Pathogenesis of HIV/AIDS. At that time, I was doing a PhD now, and there were no textbooks. And so the only research materials that we used for our PhD programs were seminars that people like Dr. Fauci would deliver. So fast forward, now that we became colleagues, and we've interacted on several platforms together, and including meeting in the White House, it just gives you that you look at life in a very different perspective. So my advice to the young people watching is that live your dreams, have character, be determined, work hard, you'll get there.
Wow, that's a fascinating story, because it seemed to be nature and nurture in many ways.
Africa defied the predictions of many experts around the world who predicted that Africa would be a killing field as a result of COVID. Some predictions said millions of Africans would die across the continent in a matter of weeks due to COVID. Didn't happen. Let's hear what Dr. Nkengasong has to say about why.
You know, when people talk about you, a lot of people talk about your courage.
Yeah.
They really mention your courage, because here you are, you land, you're the first Africa CDC director in the middle of Ebola, and you face that with so much courage. And many of the African leaders commented on your courage during COVID, because there was not a lot of data or information. You could have returned to Atlanta. You chose to stay and fight. And a lot of African leaders conveyed to me that they felt abandoned. And in the middle of feeling abandoned by the world, a homegrown African-born leader emerges, providing confidence with knowledge. I mean, you've been described as the person most knowledgeable at the time about the virus. And it was a kind of positional leadership in that you were not a head of state, but the heads of state, I watched them line up behind what you were saying. They were looking for guidance from you. They were calling you, and you just emerged as an incredible force to combat this virus, to give hope in the middle of a crisis, almost calm in the middle of a storm. How do you explain that? Were you ever, I mean, I've heard that courage is not the absence of fear, but the ability to act despite the fear.
Yeah, absolutely. I think I agree with that definition. That is, in my world that I operate, I see courage as trying to stand up to your fears and stand up to the adversary if you believe in the cause of that. When COVID hit the continent, not the continent, the world in December 2019, I remember my wife and I were in Atlanta, and we watched TV a little bit, and I immediately called the Emergency Operations Center at the Africa CDC within the African Union, and I told them to activate it. Mm-hmm. And we were in the middle of Ebola in northern Kivu, and we had deployed more than 65 people in that. So I was tracking the North Kivu outbreak and then saw this, and it occurred to me that it was going to be dangerous. I wrote a paper in Nature Medicine on January 27, where I said this threat was going to be global and it was going to come to Africa. There were 200 cases in the whole world, 200 cases, wow, with 41 confirmed in China. And most of these cases were around China, Hong Kong, and Thailand. So it became very clear. And I argued at that point that the trade links between China and Africa had increased by 500% over the last 20 years. And that the world had become more connected, interconnected than it was even 20 years ago, and the virus was going to be a threat. So the paper is there. So based on that, it occurred to me that we had to wage, and we saw the devastation, what it was doing in China. I remember China was able to set up hospital beds within weeks, and we just didn't know what was going on. Then it moved to Europe. In Italy, we saw people around February, whole cities that were completely down, and people were just crying on the street there. So when I arrived at Addis Ababa from my holidays, the first thing was to convene all ministers of health and say, you come to Addis Ababa and let's have a common strategy, because individually we will not succeed. From what I'm seeing in Asia, what I'm seeing in Europe, with the strong infrastructure that they have, we have to bond together. So it was the unity of purpose that I called them a call to action to commit to a unity of purpose. They all came to Addis Ababa on the 22nd of February, and at that time, only Egypt had reported 2 cases on the 14th of February. So we agreed that on what I call a common action plan. When you go back to your countries and a COVID case showed up, these are the things that you do. If you remember, countries like Zimbabwe, Zambia went into lockdown where they had 1 case or 2 cases there. That was implementing the call to action that we had committed to. And that helped to blunt the spread of the pandemic when it started in Africa. South Africa could have been at the same trajectory as the UK had they not followed through and started locking down where they just had about 50 cases there. So it was very courageous from the political leadership to bring their own economies to kneel because of the but very importantly was the leadership of the presidents of the continent, headed by President Ramaphosa, who was the chair of the African Union. I remember on the 26th of March, they called me up in front of what they call the Bureau of the Head of States, and they said, tell us what we should be doing. I said there were 4 things that we must do. We must cooperate, we must collaborate, we must coordinate, and we must communicate. The 4 C's. That is what I left them with at that meeting there. I said, without this, we are going to be defeated with this virus hands-on. So as you said, it was my own personal belief that I had to stand and fight and use the 30 years experience that I had learned from HIV, AIDS, Ebola, and other diseases to support the continent. Because if you remember, Rosa, the predictions were that within 6 months, about 6 million Africans would die. And we took an exception that we said, those are models. And if it can only happen if we don't fight, and we should fight. So that was...
I remember that was so encouraging.
Yeah.
When you stood up and said, you challenged that. Everybody was saying it. It was like you against the rest of the world.
Exactly.
All it was described, this is going to be a killing field. And you said, only if we don't fight.
Yes.
And I believe history will know you for many things, because you've had many firsts, but history will also know you for those 4 C's. Because we saw when you had that call to action, we saw unity in Africa among the leadership and others like we had not seen. And everybody was talking about it. And it didn't matter that you were not a head of state, that you were able to summons them. They were quoting you, and they came together in an unprecedented way. And maybe that was because everybody else in the world, in the Western world, they were focused on their own crisis.
It was, and it saw globally, it saw the collapse of global solidarity and global cooperation. I remember calling friends in some Western countries to send us diagnostics, and they just didn't even respond.
Yeah.
I mean, it was just that bad because more developed countries had secured all the diagnostics. I had a call, I remember this vividly, with the Minister of Finance of Ghana, where he said, we have managed to secure diagnostics and shipped Ghana about 20,000 tests. And he said he wanted more because the president had allocated money to buy kits. That I said to them, Mr. Minister of Finance, I don't know where to go get the kits. And even if you have the money, that's how bad it was. And the President Museveni, the President of South Africa, they will all be calling, and you just didn't know where to go get. So international solidarity collapsed, and cooperation just collapsed at that point. And I think it's a lesson that the continent must learn, that in the face of a common adversary, countries tend to forward inward and take care of their own needs first before they take care of other person's needs.
Thank God for you, because I remember getting some of those calls, and I have a lot of connections in the pharma industry in the US, and I was confronted with the same thing. I was literally begging on behalf of some countries for test kits, and some calls weren't returned and some gave other excuses, but it was a great lesson. What are some of the other lessons for Africa that have come out of this pandemic?
I think that the number one lesson that I always like to start with, and we go to other lessons, is that the political leadership has been extraordinary. The bonding together, the expression of that unity of purpose at the highest level by the head of states. They have called on Africa's CDC, put me at the center 18 times to brief them on the pandemic, and also to rely on my technical advice to determine if they should meet or not meet for their summit. And this is the first time that the political leadership is relying on science to determine whether they should have an AU summit of head of states. And 18 times they've done that on what level of vaccination we should do in Africa, what we should be doing with our borders and whatever. So I think that is historic, and it's a moment that we should record. The second lesson that the continent should learn is that it is very possible to meet your own health security needs if you work in solidarity and in cooperation. In the spirit of what I describe as regionalism over multilateralism is what I think I'm promoting a lot. And promoting it from a good place from my heart that says that our collective global health security should not be a top-down approach from multilateral systems to the country level, but that you should empower the regions to take care of their own destiny and and aspire to take care of their health security. That's what I mean by regionalism. During this pandemic, about 12 initiatives were set up in Africa. 12 initiatives, including the vaccine acquisition, including acquiring of the diagnostics through the AMSP, the African Medicine Supply Platform, the trusted travel, when you travel now across Africa, and thanks to really progressive innovators like Dr. Edem and his group, they created the trusted travel. Now you can actually do a test in South
You're
Africa.
ahead of the
Kenya.
Western world on that.
Yeah, we're ahead of the Western world in that, and I think that is something that Africa should be proud of. And the other lesson is actually that Africa should also be able to tell its story and tell the positive stories, because the narrative out there is that it's still around, why did millions of people not die in Africa? Rather than how did Africa fight this fight? Okay, that is just, so telling that story from an African lens is something that somebody else cannot tell it. Only Africans must tell the story. It has been a traumatizing 2 years, and Africa is beginning to be hopeful that the fight against this pandemic might be, we are not yet out of the woods, but at least there's hope that if we keep doing the right things and increasing vaccination, we'll put it behind us. So those are some of the lessons. Then lastly is that you should harness the assets, the technical assets that exist within the broader African community, including those in the diaspora, to fight pandemics on the continent. We had what we call the AFCOT, the African Coronavirus Task Force, set up by the Africa CDC, which brought together all Africans, be they in the United States, Europe, Asia, or Africa, and we divided ourselves into technical working groups. So the philosophy was that you bring in whatever you have in terms of knowledge, okay, in terms of advice, so that we can build on to fight the pandemic, because it was war that we were on. So building on that, there were folks that came in from Harvard, through Zoom, from Yale, from Princeton, for whatever, in the United States and Europe to fight, including institutions in Africa. That should not be forgotten, and it should be documented and built on to fight other endemic diseases going forward.
Well, I hope that that Africa will tell the story, and that you will tell the story, because the narrative and the perceptions. I remember calling one of the leaders of a U.S. pharmaceutical company asking for the test kits. That's what they, and the first thing was about, oh, they may take them and sell them. What the truth really was that they wanted to satisfy the demand. And, I know charity begins at home, but we're in a global village now. And I think this is largely because of the credibility and the reputation of the Africa CDC under your leadership. MasterCard Foundation.
It's a fascinating story. So I'm happy you link up the testing and MasterCard. So here we are in March of 2020, and a continent of 1.3 billion people had conducted about 250,000 tests. Yeah. So literally nothing, when no testing was going on. So we established what we call the Partnership for African, the Partnership to Accelerate COVID Testing, abbreviated PAC, PACT. And the whole purpose of that was to work with bilateral, multilateral, private sector and others to increase testing on the continent. And we have actually set ourselves a target of 20 million tests by May of 2020. But we didn't have the money. As the African Union, yes. And we didn't have the money. So we reached out to the MasterCard Foundation. They looked at us and they said, we'll make available $40 million. And that was the first giant donation that empower us to begin to think big. It's amazing how catalytic in terms of mindset thinking that can be. So we bought tests, and luckily, as we went into the testing market, the price had dropped. So we had committed with the MasterCard Foundation that we'll buy 2 million tests. Because the price dropped, we bought 4 million tests. We also committed that we'll deploy 10,000 community healthcare workers. Remember, at that time, we're using community healthcare workers to fight it, to go find the infections there. And we committed to 10,000. we ended up with 18,000. So they were very pleased with that. She gave them a nice accountability report and impact. So they came back in 2021 and they said, good, you did well. I mean, you offer hope to the continent and trust. So what else can we do in the area of vaccines? And we said, 4 things we can do with you. Help us procure vaccines, help us distribute the vaccines, help us strengthen Africa CDC, and support our efforts in vaccine manufacturing, the 4 pillars. So I met the board, and the board said 1 billion is possible. So we did the maths, and it was like, for me, I was shaken because it was the first time that the AU, the African Union, was going to be talking about a $1 billion gift. I mean, the African Union's budget is not 1 billion. It's less, far less than 1 billion. So the second time I met the board, they said, John, don't think about the 1 billion. Think about the problem you want to solve. How much would you need? So I came up with 1.3 billion. They said, okay, we'll make that available. But then subsequently, as we went to the vaccine market, we went back and asked for a little bit more. And they added another 200 million for a total of $1.5 billion to support the vaccination efforts. So again, it speaks to the values of trust, credibility, and character in public health practice. Yes. I mean, without those 3 ingredients, you couldn't have had convinced a MasterCard Foundation and other donors, like the Gates Foundation and the SCORE Foundation. And so other foundations just started coming in and supporting because they knew that there was some credibility and trust in what we're doing. Trust in the fight of pandemic is so important. Yes. That it's a commodity that we should not we should value.
Well, this is also in no small measure because of your leadership. And that's what some others in the donor community have told me. So we're going to take a break right now, and we'll return to this interesting insights with Dr. John Nkengasong. Dr. Nkengasong, there are people who just are groundbreaking. There are people who are groundbreaking in their leadership. And you're definitely one of those people. Because when we look at your professional trajectory, with the exception of this new role that you're coming into, you have started everything that you've walked into. I mean, I was reading about the Institute of Tropical Medicine in Antwerp. You were the first, Africa CDC in Cote d'Ivoire, 1995, at Retro C dealing with the HIV/AIDS. You were first. You started the Africa CDC in Addis Ababa. Just give me a summation of the grounds that you have broken professionally. And what advice would you have for professionals that want to be groundbreakers? What does that require besides courage?
No, thank you. I think when I look back at my 30 years career, the most exciting part of it is that I had never actually walked into a job that was there. So I walked into a concept and transformed that concept into a reality. And when I leave, there's always that regret that I'm leaving by, not me, but by the people that I'm leaving behind. The first challenge that I had, an opportunity, was after my training at the Department of Microbiology at the Institute of Tropical Medicine. I was named to be the head of the Virology and Serology Lab, which was a WHO collaborating center. But what is important is that it was the first African who came in, trained, and then rose up to the rank of the head of the lab and supervised people that train you in the lab. And I was 34 years old.
Wow.
So that leadership burden and opportunities was entrusted on me very early on in my career. Then I did that for a couple of years, and I remember going to the library to read one of the medical journals. I used to do that like a ritual. Every Monday I would go sit there and read the new things. Then I saw that a position was advertised by the US CDC in Cote d'Ivoire. to be the director of the virology laboratory. So it occurred to me that it was time to return to the continent, and it looked like a good opportunity. So I remember faxing my application with my CV to the CDC. And a week later, I was called up for an interview at the airport in Brussels. So I sat there at the airport over coffee. They interviewed me, and a few weeks later, I went to Cote d'Ivoire and started up the field station there for the lab component. Did that for about 7-8 years, and went back to the CDC headquarters in Atlanta. PEPFAR started the President's Emergency Plan for AIDS Relief. And Tommy Thompson, the Secretary of Health from the US, had visited Cote d'Ivoire with Dr. Fauci and a huge congressional delegation to discuss and explore how to set up PEPFAR. Then President Bush announced PEPFAR. So I had returned to the CDC, and PEPFAR, if you recall, the first 3 goals were to treat 2 million people,
Yes.
Prevent 7 million new infections, and take care of 10 million. But there were no laboratories in Africa that could do that. So I took on that responsibility to set up the laboratory to support PEPFAR from scratch. I remember moving from research part of the US CDC to that, and people said, "John, why would you step into a cow dung?" I mean, that it was so messy that why would you even think you would succeed? But I thought that was an opportunity to strengthen public health in Africa. Then fast forward, Ebola hit in West Africa in 2014-16, and I saw, sitting at the US CDC, I saw the way the continent scrambled, and the head of states, when they created the Africa CDC, I told my wife that I would like to go to Africa and take on the challenge. When we arrived in Addis Ababa, there was no CDC. It was a laptop and me. I didn't have an office for 1 year. So you had to start from scratch and set up the Africa. So I think I've been very privileged and lucky that in public health that I have always been this a startup innovator. Now, it takes your own conviction and your own courage to do those things, because
it's risky.
It is very risky, but in doing all of that, I've always approached it from the perspective of confidence that I can do it.
Yes.
And believing in myself and believing in others, that you can build a team from scratch, and you continue to be the orchestra leader, and you do that with others there, because it's all about doing it with others. If you share with others, you mentor them, and you make sure that what I call the mountain vision, which you are on the top of the mountain, and you see where the destination is, and you have to bring others to where you are.
It's amazing, because I think there's an important point here. It's a mindset. Where you see the opportunity to make a difference and to have an impact rather than the challenges. I mean, but you also, I noticed something, what others say about you and what I've noticed, but you do confront the brutal facts.
Yes.
You're very much a scientist. I was telling a team, I said, look, he doesn't have a lot of tolerance for the irrational, but he's grounded in the realities, but with an extraordinary amount of confidence and courage. But you also get along well with others. I've talked to a lot of people who work with you, and they speak so favorably about you and your ability to bring together teams. That's just incredible. Where did that come from? Because we're in such a divided world. Like I said, this is your rise, and the what you represent is a piece of good news in a world of chaos right now. What is that intrinsic quality that allows you to bring together? Because honestly, the way you manage to unite people across the continent, even the African private sector, eventually the donors, the African leadership, civil society, and then you created an echo chamber. even I was repeating what you said. I mean, I didn't know what's going on. I heard you and I was just repeating it. I said, well, I think this is what Dr. Nkengasong said. And I was just saying what you were saying because I believed it.
Yeah. So thank you, Rosa. I think in any innovation and managing change, there are forces for the change and there are forces against the change and against the innovation. That is just the way the nature is and the world is set up. It's not different from public health. It is true in the private sector. But you have to have that conviction that I believe I mean, at times it's also based on just being naive. That, I mean, you approach it from your heart and you know that you are doing good. And when good always prevails, I mean, when people process it all, they know that he's trying to do the right thing. The key word is trying to do the right thing because you never really know what it will look like. There will be clearly, when you take on new challenges, adversaries, but you stay focused on what the outcome is. I tell people that I mentor that nobody is ever judged by being a diagnostician, that you diagnose all the problems. Yeah. If only this person wasn't there, I would have succeeded. If this wasn't there, I would have no. Nobody cares about that. They care about, did you focus people and take them to the promised land? The promised land is the outcome. And that is what matters in the end. Did you solve the problem? I think that has been the driving force for me.
You're very results oriented.
So
what is your North Star, the guiding philosophy in your life?
Well, my guiding philosophy is that I believe in the power of good in people. That there's a fine line that divides our mind and heart between the good and the bad. And that I believe that most people want to do the right thing, and that success breeds success. And if you just have to start by doing one thing that is successful, people rally around that success.
And you're very disciplined.
That is.
No, and you're known for that. People say, oh, he's incredibly, I mean, because people might see you now, your incredible rise on a global stage, but they don't realize your process that you have sacrificed. Yeah. May I bring on the love of your life to join us in this conversation?
For the first time ever in an interview, I have Dr. Nkengasong's wife, Susan, who will join us as a part of the discussion. Susan Nkengasong is not only a wife, a mother, she is also a mental health counselor. And we know that one of COVID's greatest tolls was taken on the mental health of people across the world. Susan Nkengasong is not only part of Dr. Nkengasong's life and the mother of his children and partner, she is also a key partner in his fight.
Your story would not be complete without talking to your other half. They say that, I change it a bit and says that besides every great man, there is a tremendous, awesome woman.
Absolutely.
And your other half, Susan Nkengasong. I'm glad that you have joined us. And it's amazing that Susan is a mental health expert and counselor, which there's so much synergy. How did you meet? Was it love at first sight? Was it just destiny and a knowing? How did you meet? And you've been married 30 years.
I think it's destiny. I mean, I'll let Susan let me. I think it is destiny in the making. That is because I had left Cameroon and I was already in Europe. Came back to Africa, to Cameroon, and met her, and just decided that I was going to marry her. I mean, it's just probably me being naive, which I probably didn't know what marriage was at the time.
And you just saw her and it was immediate.
Yeah.
So Susan, how do you, sometimes as wives, we have a different side. How did you?
I think to me it's destiny as well. I got married at the age of 20. I didn't even know my left and right. I didn't even know what marriage was about. But I believe that his mother had prepared the destiny because this woman was a prayer warrior.
Veronica is my
Yes.
heroine. I want you to know.
She's never been to school. She doesn't even know how to spell her name, but she prayed the son to get married. I remember the very first time I met her, she said, I've been praying for God to give me a daughter.
Wow.
Not a daughter-in-law, but a daughter.
Wow.
And when I met her, she said, you are my daughter. And we had such a wonderful synergies. I mean, there were things that she would tell me that she would not tell the son. That's how close and how personal we were. And so she told me that she has been praying for the son to get a wife and pray for other grandchildren as well to get a wife. And she does not pray for any kind of wife, but a wife that will be like her own real daughter, not daughter-in-law. She never used the word daughter-in-law. She said she wants a real daughter. And before she died, she said, God really answered all her prayers because all the sons that she prayed, God gave them that wife.
Wow.
I think I would say it's her mother's prayer.
And I believe, I believe in the power of prayer. And I grew up with a song that was popular in the African-American community. It said, my mama prayed for me, had me on her mind, took the time and prayed for me. And clearly, Mama Veronica prayed you through.
Oh,
Yes,
she did.
I mean, we've spent time, my husband, Archbishop Nicholas Duncan Williams, with the two of you over the past 2 days here in Accra, Ghana. And my husband said he had a praying mother. He just felt it. He said he had a praying mother.
Yes.
Someone prayed him through. He talked about, Archbishop talked about, he said, he's brilliant. He has all the right stuff, but he has the favor of God on his life. And he had to have a praying mother. So I asked Archbishop, okay, I'm going to be talking to him. What question do you have? He said, I want to know if he had a praying mother. I want him to talk. So I'm glad you shared the stories about Veronica. So for all you mothers out there across the world, this is the prayer of most mothers. It doesn't matter the pain you've gone through, the sacrifices. Pray your children through.
Yes.
Dr. Nkengasong, his life is a lesson in miracles. And he's the product also of a praying mother, because there's only prayers that could. And those prayers are still following you. And I just had to, as in looking at the toll of this pandemic, just the pandemic, do you believe we're at the last mile of this pandemic?
The glass is half full and half empty, depending where you sit. I think I'm a virologist, so I'm very cautious with viruses because each time you think you know viruses, they surprise you. So the glass is half full if you are sitting in countries that have vaccinated at a very high level, which means they've established population level of antibodies that can blunt the spread of the virus or even making people more severe. If you are sitting in Africa, the glass might be half empty because the vaccination rates are not where I'm hoping that they should be, and there might still be surprises there. But overall mood is an optimistic mood. The fact that you and I are having this conversation in this room is already positive because 1 year ago we were not able to do this.
That's true.
So that is
vaccinated and distant.
Vaccination and distant.
But there are 247 million people that have been pushed into abject poverty, living on less than $1.90 a day. 53% of them is in Africa. 132 million there in Africa. And that's as a result of the pandemic. That doesn't even include the poverty that was already experienced. So it continues to have a tremendous toll on Africa. That's why your role in this PEPFAR role is so critically important, because you have a global portfolio. And I know Africa is going to tremendously benefit that. But what I wanted to ask you, Susan, one thing we're seeing is a tremendous amount of depression that's not always talked about in Africa as a result of this pandemic. We've seen people really not give expression to their depression because it's kind of taboo. We've even heard about some suicides as a result of the depression in Africa because people don't want to come forward with help. How would you counsel? It's not just an African issue, it's globally. How are you counseling people on mental health?
Well, I think mental health is something that we don't talk about it. We don't understand what it is because you don't see it. It's really a disease that happens in the head, in the brain. And it's like malaria. It's like having diabetes, like having hypertension. When you have hypertension, you take your medicine and you talk about it, you tell everybody. When you have malaria, you see a doctor, you talk about it, and you tell everybody about it. And so there is a medicine that you take. But when we have somebody have mental illness, they don't talk about it. They're in total denial. Secondly, because they would think that you are acting weird, or it's witchcraft, or since nobody understands what it is, they associate it to something that weird behaviors. And so we tend to hide it away because you don't want nobody understand what is going on. There's, I will share the story about a lady who killed herself in Addis Ababa and killed a son. She's been struggling with depression for a while. Nobody knew about it. They knew about it, saw weird behavior, but nobody raised an attention and said this is an illness. Awareness. It's like malaria or like diabetes. Nobody did that. And so one afternoon she killed a son. She had two sons. Killed the son and killed herself and wanted to kill the second son, and he ran away. So if you look at that, there are behaviors that comes with mental issues. And nobody pay attention to those behaviors. What the ladies were saying was, she's acting weird. She doesn't come to the group anymore. We don't see her anymore. And once you start noticing such behaviors, those are signs of mental illness. And so the earlier you begin to identify them and address them, you have to heal that person. But when you begin to judge them and see a person as weird, as not acting right, as always complaining, yes, and then you don't address it, it leads to even a suicidal thought. And it starts with a little crack. It starts with some little things like maybe stress related, maybe could be the children are acting up, maybe
so the
job.
Call to action really is to remove the barrier and the taboo in talking about it.
Yes.
It's like we talk about other.
Definitely. I mean, it's especially when you talk to people that are in church, they're like, no, we just pray about it and it goes away. And then
but
question,
they wouldn't say that about
cancer, diabetes.
They would do both.
Definitely. So because if you are taking a chemotherapy, you take a chemotherapy and you still pray. So why will somebody be diagnosed with bipolar, schizophrenia, and they don't take the medicine, they just pray, and that God will heal them by, just praying. It works both ways. Just like you take chemo,
I always say God is sovereign.
Antidepressants.
He can use anything.
Definitely.
To heal you. He can use medicine. He can use science, and he can do it supernaturally.
Definitely.
There's one story, and as we close this out, that Dr. Nkengasong mentioned about when he chose not to be evacuated, because anybody could be evacuated during the crisis, during COVID. And nobody really had all the answers. All we knew is that something was spreading and killing people. Mm-hmm. And you were in Addis Ababa, correct? and Susan was being evacuated. And tell us about that time at the airport where you had to say goodbye and you weren't sure you'd ever see her again.
No, it was very, I would say, a very troubling moment for in the fight. Because here I am managing the continental response. And the U.S. Embassy had decided that they should go on authorized evacuation because nobody had, there was no oxygen in Addis Ababa, no ventilators and nothing. So you remember in 2020, we were fighting it with our naked hands. I mean,
It was nothing.
a combat fight. We fight in the trenches, but that is what we
Yeah.
had. So I remember calling her from work that she should get ready and get to the next flight and join the evacuation team. And also, Rosa, it's important to know that the stigma around it was just greater than it is today. It was that if you died of COVID, you'll be buried where you are. You actually
Because of the Ebola
it
kind
was
of.
like nobody is going to transport your corpse. So people had run away from Addis. The diplomats have all went back to their respective homes and countries of origin and say we better be closer to home, die there than die in Addis. So I remember calling her and saying, I think she had two choices of either leaving on the Wednesday or on Friday. I said, please leave on Wednesday because there were two things that were driving that. We were in the middle of a fight, and it was important that I fight that, knowing that we were parents and that the two of us, it was better that somebody is protected. That I didn't tell her this because I didn't want to panic her. And I said, you leave, go back to Atlanta, stay in a home there, and then at least if COVID comes and kills me, you survive and you can take care of the children. That was the whole concept. So she left. At the airport, I remember driving her to the airport that evening, and we hugged and I waved her by, and I didn't turn to look at her because I knew that was probably going to be the end. Yeah. Because we had nothing at that time to cater for. There was no ventilator, and
I know.
the virus, and I was at the forefront fighting it, and the commission leadership politicians at the commission had run away. So,
I know.
yeah, so it was just like a determination that we have to go to the bottom of this. We have to fight and find the diagnostics, find the PPEs and whatever. And they started coming in. We'll go to the airport. I spent more time in the cool room at the airport in Addis Ababa, distributing to countries and calling airlines to Ethiopian Airlines, and we call, say, so Ethiopian Airlines will take off to a country, the airspace was locked. We'll be calling them to unlock the airspace because Ethiopian Airlines will land sooner. But that moment was a decision that I took, knowing that we had to protect the family, that if the two of us stayed in Addis and we were infected and died, it would be disastrous.
Wow. Well, that is really a true test of leadership when you're prepared to make the ultimate sacrifice. And you're trained as a scientist, not a soldier, but you were prepared. I just want to thank you. I want to thank you both. I want to thank you for sharing your story. I want to thank you really for the example, because that's a great testimony of leadership. Be the change, be what you want to see. And I told people at the beginning of this time together that they would better understand why I believe that, and I'm calling for you to be nominated for a Nobel Peace Prize. I know you have a lot of humility, but in this season, you've done a great thing, and I know there's much more work to do, but we're glad to have you at the helm. All the best. Thank you so much.
Thank you.
Okay.
I have been inspired and indeed empowered by Dr. John Nkengasong's journey. For me, it's a journey of character, commitment, competence, and most importantly, courage. John Nkengasong lives beyond barriers. He wasn't discouraged by fear. He wasn't discouraged when he confronted death. He wasn't discouraged by the dire predictions. He forged ahead with resilience, a resilience that I see is now sweeping across Africa once again. Thank you for joining me.
Congratulations, Dr. Nkengasong. And thank you for being a source of inspiration for not just the younger adults out there, but also the older generation still out there realizing their dreams, not just in Africa, but globally. Je vous souhaite le meilleur, monsieur.
Dr. Nkengasong, we want to show gratitude for acting as an inspiration to the African youth all over the world in the continent. Thank you.
Thank you, Dr. Nkengasong.
You are a great fit for this new position. Congratulations on earning this amazing opportunity, Dr. Nkengasong. You are truly a modern-day African hero.
Thank